out of this CDC decision. This is a huge one.
A really big decision, and I'll preface by saying I had a chance to speak to Dr. Walensky after the briefing as well, so got a little bit more of that back and forth. It was a big decision, and I think it was really up until the last minute a back and forth between various people at the CDC trying to look at this data and come to this sort of recommendation. I think even a week ago, it was not at all clear that they were going to do this, just to give you an idea of the pace of this. But I think it was a few things. First of all, we know that the case numbers have been dropping. We can show that. You've seen that for some time. They wanted to make sure that that was going to be a continued trend, and it certainly looks like it is. I think one of the big things as well, you remember we know that the vaccines are very good at protecting you from getting sick. There were two open questions still. One was, how good are they at preventing asymptomatic infections? Meaning you could still carry the virus even though you've been vaccinated. There was data that came out of Israel. I think we talked about this on the program at the end of last week. This was published in the New England Journal of Medicine, but basically showed that after 2 doses, you're fully vaccinated, the chance of being symptomatic greatly reduced, 94% protective, but asymptomatic as well, 90% protective. So not perfect, but really good at preventing what are these so-called breakthrough infections. But then the final piece of data, which I think was the most critical perhaps for Dr. Walensky, was emerging data that basically shows if you've been vaccinated, even if you've been infected, even if you would test positive for COVID, the chance that you would be able to then spread that virus was really, really low. You simply don't create a high enough viral load in the body. That was a critical piece of data for I think the CDC and Dr. Walensky to go ahead and do this. I got to tell you, it was still very surprising. I mean, having covered this story so intensely for 14 months, that was a turn on a dime. I thought it was going to be a much slower sort of transition process into this, but basically saying, look, if you're vaccinated, no need for a mask, basically, in any situation, was obviously a very significant move.
I'm so glad you pointed out the breakthrough infection finding, Sanjay, that even if you get it after being vaccinated, you're really unlikely to spread it. That is key. We have more questions about how this is going to affect all of us in real life. Practical questions, right, Sanjay? So how hard will it be for businesses and local governments to navigate these new guidelines?
I think this is going to be the biggest challenge, you know, and I think the CDC is basically saying, hey, look, we're here to make the recommendations, and now communities, states, businesses, private, public, whatever, are going to have to sort of figure this out on their own. And I can tell you, just even overnight, you're seeing basically the reaction. Nevada, for example, they basically have decided, even before this, we're just going to follow whatever the CDC says. So now the CDC is saying you don't need to wear masks indoors. Their casinos, crowded areas indoors, are no longer going to have mask mandates. Now, you know, the guidance is that if you're unvaccinated, you still need to wear a mask, but there's also no mandate to check for vaccination status. So that's going to be a really tricky one. State of Hawaii, on the other hand, says, look, we're going to take it slow. We're still going to have a statewide mask mandate. Los Angeles County saying the same thing. Minnesota saying the opposite. So you're going to get a mishmash here, and it's going to be left a lot of times on these, you know, small businesses, grocery stores, movie theaters, whatever, to determine how they're going to do this. One thing that doesn't appear to be, at least at the federal level, something that's going to happen is some sort of vaccine passport. The idea that you have a passport, you show it, and therefore you could definitively not wear your mask, go through another line, whatever it may be. That could happen at private venues like sporting events and concerts and things like that. But this is going to be a very interesting and I think even maybe tense time. I mean, so as a local business owner, what is going to be your sort of obligation then to say, hey, are you vaccinated or not? Are you even allowed to really ask that question? You are allowed to ask it if it's a private organization, but who's going to do that? Well, that remains to be seen.
Yeah, I mean, we do have passports, right? In a way, we have these cards that show if we were vaccinated or not. We have our vaccination cards. Another question from a viewer. There was always a question about air travel for vaccinated people. What changed with that guidance?
So this is really interesting, and Caitlin Collins was at that briefing, and she asked Michelle Walensky, Dr. Walensky, about this, and Dr. Walensky sort of passed on the question and then got asked again and passed on it again. Well, I asked her, and I said, look, what is the guidance, and explain it to me. And the guidance still is right now that if you're on these types of airplanes, trains, buses, you still need to wear a mask, period. Vaccinated, unvaccinated, doesn't matter, you still need to wear a mask. Now, how does that make sense, right? You just said vaccinated people don't need to wear masks indoors. How does this make sense? And what she basically said is we're making recommendations at this point for individuals around the country, but entities, in this case the aviation entity industry, can basically make their own guidelines. And they probably don't want to be in a position, like we were just saying, of trying to figure out vaccination status of every passenger on the plane. So for now, they're going to still recommend that, they're going to mandate, frankly, on planes that you still wear a mask, regardless of whether you show vaccination status.
Look, Harriet has talked to us about some of the overlay between people who are unvaccinated and people who are reluctant to wear masks, and unfortunately there's a big overlap there. So that's part of the concern going forward. I want to bring in